Welcome, everyone. Welcome, everyone. I see everybody pouring in as Roy opens the virtual gates. Thank you for coming. My name is Suzanne Stewart. I'm the director of the Waakabeness Bryce Institute for Indigenous Health Research and a researcher with the Ontario Network for Environments in Indigenous Health Research. I'm here today with our knowledge keeper, Clayton Shirt, and our community partner and researcher, Pamela Hart. And we're here to do a presentation on some research that we've been doing over the pandemic around COVID and mental health. So before we get started, we are going to invite Clayton to do a spiritual opening. And just a reminder to everyone that we're recording our session and it will be archived on our website and our YouTube channel. Clayton, which?
Good morning to everyone. Just take a moment or two and I'll just say it in this language. We're going to invite spirit into wherever you are and in this virtual circle. I'm just holding this feather and this eagle feather, and I just want to say miigwech and good morning to all of you and thank you for coming. And we're all busy people, and I just say, so take a moment or two and we'll just invite spirit. And I always like to say, just take a breath and just breathe and just. And I'll begin in this prayer, and it's just I always like to say miigwech, and I say thank you again, and invite spirit into our hearts and our minds, and I always say miigwech to our first mother of all mothers, Mother the Earth, for providing everything for us, the people and our relatives. So with one mind, one heart, I say miigwech to her. And again, I pray to her, I pray for her in gratitude to our first mother of all mothers, our Mother the Earth. So with that, I say miigwech, and I offer my prayers. We offer our prayers, our thoughts to Father Sky. Again, we ask the spirits of our ancestors in a good way, in a kind way, in a loving way to be with us. And know that they're always with us, but we say thank you for protecting us physically, mentally, spiritually, emotionally, to our ancestors. We invite them to be with us and listen to us and guide us in a good way, in a kind way. We say thank you to Father Sky. Again and again, I say thank you from my heart. I offer my prayers to Grandfather Sun for a new day, a new beginning. I say thank you for everything you do for us, for bringing the light, for making the medicine grow, for bringing the warmth. And I say thank you, Grandfather Sun, for the day, for the new day, a new beginning for us, the people. So with one mind, one heart, I say all my relations. Again, I say miigwech to Nukamis, grandmother of all grandmothers. I pray to you, I pray for you in gratitude from my heart. I love you. I say thank you for everything you do for us. You put the waters, the rivers, the lakes, the oceans into order for us as we sleep, as our children sleep, our babies sleep. You do this for us. And I say thank you for this, for water is life. I say thank you and many other things you do for us, grandmother. I love you again. I say thank you for everything you do for us. So with one mind, one heart, I say all my relations to you. I offer my prayers to you. We come here together as the people. We offer our prayers to you, great mystery, creator of all creation. Again, I'm just sitting here. Again, I say thank you, for there is nothing beyond you, creator. I say thank you for the gift you bring us together and help us in our minds, to open our minds, open our hearts, remind us, remind myself why we're here. To work for the people. May we always have this in our minds and our hearts. I say thank you, Creator, for this beautiful gift called life. All my relations. Miigwech, miigwech, miigwech. Thank you for allowing me to say that simple prayer and to invite spirit into wherever you are. And I say thank you for this. All my relations. Miigwech.
All my relations.
I'm going to switch these now. Miigwech.
Thank you, Clay. This is exciting that you have a presentation. Well, and since Pamela became the ED here at Native Women's Resource Center of Toronto, there have been wonderful transformations in services provided to our urban Indigenous women. And that's what we're here to share with you today, the great work that's being done at Native Women's, especially over the pandemic. So maybe I'll let Pamela introduce herself, and then we can share some of the work with you.
Good morning, everyone. Pamela Hart with Native Women's Resource Center of Toronto. My spirit name is Wasakane-Kwa, the light that is endless through time. I have been with Native Women's for just over 4.5 years, working with Suzanne for as long as I can remember. Since I've been in the field, Suzanne has always been a supporter of mine and the work that I've always done, regardless of where I was working in the community. And I feel very fortunate to share this presentation and share this work with Suzanne and her team. I've also worked with Clayton for a really long time. So it's really an accomplishment to sit in the center with both of these individuals and share the work. It's something that I feel very fortunate to be able to do and very proud to do. This report that we're going to talk a little bit about is something probably of my first in my career. While I've worked in agencies that have done reports like this and sort of researched the work and evaluated the work and the efforts, this one's special because I get to sort of co-lead this one, but also because this work at the center is special. It's unique, and it was unique through a pandemic, which is something I haven't seen in my lifetime. And the agency was very lucky to work together, work with community partners, and pivot very quickly to serve the community and the Indigenous women in a special way.
Thank you, Pamela. It's really humbling to hear that, and I'm really honored to be working with you and supporting whatever work that you're doing. So move with that, Nancy Cho. So I just want to acknowledge some of the students and other researchers who helped with this. Dr. Gabriel, Jenna Wilson, Elizabeth Bercutis, and Sarah Ponton, and Jay Liu also helped with this report, although Jay's name is absent, and that's my bad. My apologies to Jay. So as Pamela shared, some of the background to this is really about how our relationship was the basis for allowing us to work together to respond to some of the needs of Indigenous women during the COVID-19 pandemic. And what happened was that I think I reached out to Pam at the beginning of the pandemic and said, hey, how are you doing over there? What do you need? And is there any way that we can support what you're going through right now on the front lines of this evolving situation? Because you have to remember, in March of 2020, we didn't really know what was going on. And we just knew that doors were closing, people were told to stay home. And yet Pamela and her organization had an urgent need to continue to provide services to the urban Indigenous women and girls community. So that's kind of how we started. I don't know if you want to say a few words about how we started working together on this.
Yeah, so when it hit Native Women's, obviously the team worked from home except for myself and the manager at the center, but we sent the staff home, and we quickly pivoted to self-directed programming online. So March 18th, when the doors shut, we actually were still able to provide programming, and I think that was really significant. And then receiving a phone call of support from Suzanne and her team was pivotal in elevating the next sort of turn of programs that were able to fill gaps. And through our conversations, we knew that something had to be Indigenous women specific and led from an Indigenous women's perspective. And so through our conversation, we identified some gaps and some difficulties with the staff working from home and what that meant for access. And so a lot of this work was about access and providing opportunities and innovative ways to access the center, access the staff, access programs, and access culture.
Yeah, so that was sort of the background of how we ended up here together. and why we started doing this work. And, so once we started doing this work together, we realized that there was, something that we wanted to know research-wise from our end as, as a research unit, and that was how do clients of Native women's access and use mental health services, and what culturally based mental health services are most effective at preventing and ending the cycle of homelessness during the COVID-19 pandemic. So part of asking this question was also helping to develop the services that were needed to resist having high negative impacts of mental health struggles during the pandemic, as well as to resist homelessness. I mean, homelessness isn't the main thrust of the services here, but I know that many clients who access services are precariously housed or at risk of homelessness. So that was why that was really included. And some of the programs that were developed, I'll let Pam talk about them, that we developed together in this time were.
So one of the first things we did was the emergency hotline. So this was a platform for community members to call in and speak with someone who would triage you to the appropriate staff given your immediate needs and make the referrals to the staff via email or phone. Additionally, what we were able to do was to utilize our 2 in-house healers to connect them to have one-on-one sessions via telephone. But we were also in that first year able to employ, I think it was 5 other elders from the community and knowledge keepers to also provide that one-on-one interaction for community members who needed that connection to the knowledge keepers, to the healing, to the teachings in a really pivotal time of need when folks probably most needed access to spirit and culture. I also viewed it as an opportunity to provide those elders with their access to the community, because they also were working from home, and this is what they do, this is what their gifts are, was to be able to work with community, provide those places of healing and listening. And so it kind of worked both ways, where I thought we were going to be able to give the elders opportunities, but also the community opportunities. Immediately, we enhanced our grocery support program, which used to see maybe about 10 people every Friday. Now we're up to about 100 people. And if we served longer hours, we probably would see greater numbers. The increase was immense. We also enhanced our hampers to have all baby items, gifts for moms, activities for children. So they had healthy activities to do while isolating at home, not being at school. We provided school supplies. And we also enhanced things thinking about the change of seasons. So kids need new running shoes in the spring, and how can we supplement that for moms so that they're not expending their budgets, putting them at risk of compromising paying rent and then leading to homelessness. We put women in hotels so they didn't have to sleep outside in encampments. And housing was one of our biggest advocacy during the pandemic, and still is. The need for Indigenous housing for Indigenous women, self-identifying women, is critical. There is nowhere to send our women, and it's only getting worse today. And so housing is one that we maintain as being a front leading issue and a responsibility of the city and the province. Just throwing that out there.
We need to get our shelter and transitional housing program back up. So from the research perspective, while we supported the development of these programs on the ground at Native Women's, we were also hard at work on the research side, helping to identify, refine, and assess these interventions that were evidence-based, using Indigenous knowledge as evidence. And we created this culturally based mental health and healing model for the programs here at Native Women to be based in. So how did we do this? Well, we collaborated with Pamela and her team. We also worked with elders and knowledge keepers like Clayton and other knowledge keepers in Toronto. And then we also had youth from the community employed on the project, and Indigenous and non-Indigenous graduate students and undergraduate students. And how did we decide to together do this evaluation? Well, we used mixed methods. So we did an online survey, and then we also did individual interviews with all the people involved in these programs and projects that were developed and implemented during the pandemic. So we did surveys with clients because we thought that that would be safest for them, for their anonymity, because sometimes I think that clients feel uncertain about doing surveys or actually even participating in evaluation in research, because I think they feel, and rightly so, that it can compromise their service and their access to services at an organization. So we wanted to maintain the anonymity and the confidentiality of the clients, yet get them to give us honest feedback about their experience with services of these programs that were developed during the pandemic. So we created the survey together, and then we put it out there online. We would have liked to get more than 26 people, but that's what we got. And during the pandemic, I think data collection was a bit of a challenge because people had other things on their mind than doing research interviews. but I think it was good. We really pushed it out, and we did get 26 clients to do the survey. And then we also interviewed the staff at Native Women's about their experience of delivering services during the pandemic and how they thought that clients were doing during this time, to look at sort of the strengths and the challenges that everyone faced. So the interview questions were sort of things like, tell us about Indigenous mental health during the pandemic. We're interested in the cultural supports and challenges that they or their clients have experienced. We wanted to know about how Indigenous knowledges were present in mental health services, and how these helped clients resist or avoid homelessness. And what did they consider to be the most important thing about Indigenous knowledges and virtual mental health services? Now, as far as I know, that question is the only time that's ever been asked after or during the pandemic, because a big thing that happened during the pandemic is that cultural and spiritual things went online, which had never happened before. And I think if pre-2020, you'd asked anyone if it was okay to do a ceremony on the internet, the answer would have overwhelmingly been no. And now we have ceremonies every day online. Clayton just did an opening ceremony for us, a smudge and a prayer online. Other organizations, including Native Women's, have offered ceremonies online or for groups or individually. So we thought that was an important thing to ask people about. And then sort of, where did people see the future of mental health services in the context of what we had experienced during the pandemic? So the survey yielded overall highly positive results, saying that most clients had above average positive views and experiences with Native Women's services during the pandemic. And particularly what they said was the interactions with staff were the most highly rated. So they really felt like they had really great services with the relationships that they had, either new or existing with the staff. So I think that says a lot about Native Women's ability to connect with people, that was one of the strongest things. Only half of respondents said they would refer someone else to Native Women's. We don't really know what that was about, but maybe it was because everyone they knew were men. That's kind of what I was thinking about why people said that, because we know only women can access services here mostly. So here's just kind of a snapshot of some of the specific things that were highly rated in the survey results. So it was things like the friendliness of the staff member, the caring and concern, the respect that they got as an Indigenous person, which we know is so critical for cultural safety, the extent to which participants' needs were met and that they were provided with respect, that they felt like services were well explained to them. And, you know, actually that was no easy feat because during the pandemic, everything got complicated because everything was either on the phone or by email until you actually got to having the service, which might have been on video or could have also been on the phone. So I think that was really amazing. People really felt like they got help or advice when they needed it. And they also felt that they were responded to in a reasonable amount of time, which is also amazing, given the crunch of staffing that they were experiencing here. And you know, and that goes along with the following up or contacting people in a timely manner, and that they felt that the effectiveness of the support for their health and mental health was very high, and that the quality and access to programs and services was also high. The results of the staff interviews, because they were qualitative, were a number of meta themes, and those were really around, sorry, I don't have my reading glasses on, so I have to kind of squint to read the meta themes. Can you read them? Your eyes are younger and better than mine.
Holistic mental health, wellness in COVID-19, technology transition, culture and spirituality.
There's one more, but gotta move that thing.
And the last one was community needs and connections.
So we have a lot of themes that underlie these meta themes, and the interviews were really, really rich. So, you know, I would say, you know, I'm pretty steeped in this data because I really helped with the across participant analysis, which, you know, we're used to doing. We do the way I was taught to do research and the way I still do qualitative research is coding by hand, which means we have everything on sticky notes and we're physically moving codes and themes around to get these meta themes. We couldn't do that this time because of the pandemic. And one of the research assistants found this program called the Jamboard, which does the same thing but virtually. So we did like a virtual hand coding. So we were really immersed in this data. And I would say, you know, you can all, on the other side of this, the audience can look at these, and I'm not going to read them all, but I would say, having gotten in-depth and personal with all of these interviews, the codes that underlie the themes and the themes that create the meta themes, were that most of the things that were challenging were really around technology. And the things that were the biggest strength were really the relationships that people had with their clients and among each other. The staff really supported each other during the pandemic. And they really felt that anything to do with culture and spirituality became even more important than it was before the pandemic, because there was a sense of scarcity of access to culture and spirituality because of the stay-at-home orders, the physical distancing, all that, and that all heightened people's anxiety and any other predisposing mental health issues. Depression and anxiety spiked, and also a lot of people's trauma and intergenerational trauma was also activated during the pandemic, which staff had to deal with, not only with each other, but also with clients and with the community. So those were some of the challenges that came up. I don't know if you want to comment on any of that.
Yeah, I think, you know, the staff at Native Women's is our community members. And so as the part of the leadership of the agency, I remind myself every day that they are community as much as the service users are community members. And so we really had to ensure we were wrapping care around the team as much as we were the community. And Indigenous women, trans women, two-spirited folks, they're already so isolated, marginalized, and face unique barriers. And so when the pandemic hit, the initial thought that this was going to only increase that anxiety, those barriers, those worries, that isolation, we really tried to ensure that everyone had something that met their needs and produce and provide a variety of programs and services for both the staff and the community that would meet their unique needs when facing their mental health and stressors, given the uncertainty of everything that was happening around the city. and also the levels of fear of, physical health, the worry that you have for other community members that you see struggling on the streets, living in tents as that number increased around us. So it was complex, but what I do know is that Indigenous women are natural leaders and caregivers, and that while it was all very intense, the work was all very natural, that the response was very much all within us, and that it was very much driven by culture and spirit, and that we were doing the work that needed to be done for the women of the community.
That's amazing. So just a reminder to everyone, we will have time for some questions and comments at the end. We'll leave about 10-15 minutes for that. So if you have any questions, please type them in the Q&A or the chat, and we'll make sure that we get to as many of those as we can. Oh, I don't know why it's not advancing. Speaking of technology, still is an ongoing struggle. I don't really know how to operate computers, so I have to leave it to the people who do. Maybe we should stop share and reshare. Sometimes doing that helps. That's okay. Everyone's patient with the well, that's okay. We don't need it. We can, I see you're so organized. You have it printed out there. We can just share the last part, because we're almost at the end of the presentation anyway. So we can just stop share. You better do it though, so I might break this. I don't. Okay. So so while we're waiting for that to get resolved or not, we can just talk about what these results mean. And I think Pamela said a lot anyways about it. And oh, look at that. See, she knows what she's doing. What the results really speak to is, that the services that were offered did meet clients' needs in substantial ways. And that was reported both by the service users in the survey and the staff in the individual interviews, and that the challenges that were shared in both data sets were really about historical issues that predate the pandemic and were exacerbated by the experience and impacts of the pandemic, as Pamela shared. And those are things like access to service, racism and oppression, and direct trauma and intergenerational trauma. And access to services includes things like housing, traditional medicine, all that stuff, all the different services that people need and want that they had a difficulty accessing even before the pandemic. So I think that that's really important to know, as well as, I think the points that Pamela raised are the important discussion points, which are that our community are the ones who help each other. And it's not necessarily that people need to go to the outside of our Indigenous community to get the things that they need. We have all the resources within our community. We just need to be able to figure out a way to offer them in ways that aren't, I'm not sure how to say this in an eloquent way, but without like relying on the man, without relying on the man in the system, and to have that autonomy and the autonomy and the self-determination. And those are kind of, I'd say, the bigger issues, not what we can do. When we have the resources, we can do anything, and we do. Look at what Pamela has done here, and look at what happens at Native Women's. But when the resources aren't there, which they aren't a lot of times, it creates a lot of barriers. Can we still keep going? Anyways, so going on with that, I guess the other piece that's important about the results is that the strengths of Native Women's to meet their community's needs are very clear, and that's a really important piece to understand and to take away from this evaluation. And that basically in the city of Toronto and the province of Ontario and the country of Canada, there is a lack of policy in place to support urban Indigenous women. And that's really where I was coming from in my own words about about working outside of the control of the system. And when I say the man, I mean the system. It's not any man in particular. It's the system, the colonial patriarchal system of our multiple levels of government. You know, so those are the biggest challenges that really, I think, stand out and are important to note going forward from this research.
And if others have ever heard me talk before, I think my repetitive message in the last year is that sort of the systems in which Indigenous women interact with, they're not our systems. They weren't designed for us. They were actually designed to work against us and to inflict harm. And so while some of these systems have changed forms and changed names, the intent and the creation of them still are rooted back to create resistance and harm within our community. And so it's important for these systems in which we do have to interact, do develop these policies that are Indigenous led, that do create accountability tables that are Indigenous led, that have women at the forefront speaking out on whether or not they're doing a good job, whether or not they're serving the Indigenous community, and whether or not they're responding to the inquiry report. Because while they may not have policies in place, there have been reports put in place that very clearly direct how you can take first steps. And we still have yet to see these important and massive systems take steps that will serve our community in a good way. So this policy piece is massive. And the Native Women's Resource Center will continue to speak out on that.
So, and that kind of leads into some of the recommendations from the report. Do you want me to do them, or do you want to do them? Oh, they're for me. Well, they're for you. They're for the system, really. You know, and this was something, you know, about preparedness. And this isn't just for Native women. I think this is for all of us who lived through the pandemic. Is, you know, we want to have kind of a chest of things ready to go for, like, you know, for when something happens.
And I think through the pandemic, we were able to learn who and what works. So who are these partners that are going to be mobilized? You know, there was staff from Suzanne's team that came and drove hampers to clients' houses, who came and
know who you are.
Yeah. Who bagged rice and bagged pasta to make these hampers for community. And that's a game changer. While bagging rice may seem like a task that maybe is mundane, it actually changes lives, and it changed lives each week. And I think that understanding where those people are and leaning on them and leaning into those partnerships when the time requires it is really important. And to remember that our culture is this collective body, and we always have been, and we each bring different gifts. So how do you build that together? The other thing I think is having your advocacy efforts ready and in control, because when you are in a time of crisis, everything gets exposed. And so how do you create benefit from that? How do you use that as your moment to demand action and hold the governments and the systems accountable? And so I know now who we can turn to. I also know what our advocacy is and what language needs to be used moving forward. We also have learned that spirit and culture is the answer before moving forward on anything massive that will impact your community. That the grandmothers, the ancestors, if you are connected, if you use that as your guiding tool when operating as an agency, when serving community, that you will all be protected, that the community will be served in a good way.
Amazing. So lastly, you know, you talked about this, you know, the continuing to engage in this work and to leverage the strengths that you already have. And so that kind of leads us to our, you know, big ticket like result from this is developing a model for pandemic or emergency response based on these results from this research. And that is really about having continuity of service, increased basic needs service, enhancing spiritual support, increasing mental health support, the advocacy for policy change that we just talked about that was so important, and having a communication plan. So having these things in place for an emergency response, I mean, hopefully, fingers crossed, we're not going to go through a global pandemic again in our lifetime or in the next, you know, so we may not need to plan for that, but there are other emergencies that happen, and having this model in place can help us to mitigate some of the challenges that we already know exist when we get into a state of emergency.
I think that we are in states of crisis when we look at our community, if we're looking at the rates of substance use, if we're looking at the rates for violence and human trafficking towards Indigenous women and girls, I think that you can apply this in a critical way to address that as an operational perspective to serve the women and take a spiritual and practical approach to all of those barriers that the community is facing.
So, you know, the next steps, well, you know, unveiling this model to the community, and this is the first step in this. So, you know, we've just finalized the report, and this is our first time bringing it out into the world and sharing it with people. And we'd like to have cultural and spiritual ceremony. Is it already fall 2022? I don't even know where I am. But I think before snow hits the ground, we want to do something out, you know, in the community for the people to share these results in a community report, whatever, you know, Pamela and her team thinks that we should do to share these results in a good way. And of course, to do the usual publications so we can share with other researchers and policymakers and whatever else that Native women's leadership and the community wants us to do with these results. We'll work together to do it. So if there's any questions, I can't read anything because I don't have my glasses, but maybe Pamela, if you want to check if there's any questions there. They might be in the chat too. That's possible, but I don't know. Oh, and Roy also said that there is a feedback survey just for this presentation, and it's good for us to get those. So if you can feel those. Our audio is a bit off.
Our audio was off.
That's okay. I'm sure everyone still heard us because I have a loud mom voice. Clay, do you have any comments or questions you want to make? Are you on the phone?
No.
Oh, okay, okay.
No.
Come up here behind us so we can see you.
Sure.
Oh, we do have one question.
Do you think your model applies to different groups of Indigenous people? Oops. Do you think your model applies to different groups of Indigenous people? I imagine it does because, as mentioned, this work was created for Indigenous women by Indigenous women. But as mentioned, Indigenous women are taking a leadership role, and we carry certain gifts that care for our community. And so I don't see why this model can't be applied in different groups of Indigenous folk and catered to the specific folks that you're working with. I think the uniqueness of what we do is being Indigenous women and trans women, non-binary folks, inclusive, and having 2 Indigenous women healers that work for the center. And I think that because it's such a unique space with that guidance of the healers and the guidance of spirit, but also the women serving the women, it creates a certain tone in the center that is really special. Is there a role for non-Indigenous allies to enhance or amplify your excellent work? Thank you, David. Yeah, I mean, something I always tell allies is to learn about the work, learn about the agency, you know, in your area, about Native women's, and share it out into your circles. And because your circle is different than my circle, and that's one way to sort of get out the knowledge about who we are and what we do and the significance of why we exist. I think also lean into the discomfort and have those difficult conversations in your circle, challenge folks who maybe don't have a deep understanding of Indigenous community members, and really try and challenge the conversation in all of the spaces that you get to attend that maybe I don't get to attend, and that just spreads the conversation further. You have an answer?
No, I thought that was an excellent answer because I have a hard time with that question. So,
Were you able to relate your research to the health of the planet?
were you able to relate your research to the health of the planet? That's a good question. I'm not sure that directly we talked about the climate crisis in this project, but this has actually springboarded us to another project looking at mental health impacts of the climate crisis with Indigenous young people that we're collaborating on as well. That's in an early stage, like we did a pilot with that, and now we've scaled it up to get some money to do a bit of a bigger project. So I don't think we directly asked about that in here because we were really dealing with on the ground immediate emergency situations that were really life or death when it came to COVID. So we didn't get around to thinking outside of COVID itself, but this partnership and this research specifically did lead to me saying, hey, Pam, you want to work on the climate crisis and mental health project with us? Because this went so well. And Pam very generously said, yeah. So in that way, yes. No, I can't read. These are too small for me.
Do you have suggestions? The pandemic brought to everyone's attention barriers and inequity that many of you are already aware of. I feel this awareness is fading in the mainstream as everything opens up. Do you have suggestions on how to keep inequities in the spotlight and to have them addressed? I guess, again, it's about learning, educating yourself, and then speaking up. We have a new council that's going to be sworn in. We have a returning mayor. So I think that those are avenues in which the city should be held accountable. They have voted unanimously on a reconciliation action plan that needs to be directed from the community. And so how do you support stating that the community should be driving those efforts and approving the work? I think that we are so quick to forget that we have found thousands of graves of children across Turtle Island. I think that we're quick to forget that there's an inquiry report on missing and murdered Indigenous women that still goes unanswered. And so I just urge everyone from the community or not from the community, learn about the important advocacy work and the essential needs work that the community agencies are doing, that Indigenous research teams are doing, because all of that has extreme value to the preservation and the longevity of the work and of the community members at large. And so really it's about speaking up and acting bravely to speak out on the issues and the matters and the work that's being done, because not everything is doom and gloom. There's a lot of beauty, there's a lot of perseverance, and there's a lot of things to be proud of. So we can have all of those conversations. We just need to have them. They need to happen outside of webinars. They need to happen outside of, you know, guerrilla advocacy efforts. That's totally my style. If any of you haven't seen the newspaper we did for MMIWG, please go to our website and check it out. But these are the things that need to be spoken about. There's a lot of work that still needs to be done, but there's a lot of work still happening. And so I really think it's about learning and keeping the conversation going.
Absolutely. And we have time for one last one. Can we do this one?
Yeah. I was curious as to which non-Indigenous settings this research will be presented to. Will any be in Vancouver?
I think that person's in Vancouver. So actually, I might have put this up to Healing Our Spirit Worldwide, which is going to be in Vancouver next year. Did I say that? I feel like I did put this to be presented at that. It's an Indigenous conference. And we'll be presenting it all over the place.
And if anyone has any questions, you guys can just contact the center.
Yeah, and Roy can put my email, and I think we had our emails in the last slide, but we took it down for the questions. But yeah, you can look up Native Women's Resource Center of Toronto on the internet, and my email Roy's gonna put in the chat, and his too. If you have any questions about anything, you can reach out to us. And with that, maybe we'll move it over to our Elder Clayton Shirt to do our spiritual closing and make any concluding comments that you think are important.
Sure. Which I was just thinking, and I was thinking about the history and the past, and about how strong, and I was just in awe and such a privilege and honor to work with these strong two women. And I'll just say this in the beginning, when we were waking up from the residential school experience, colonialism, etc., in the 60s and all this, it was the women who picked up the bundles first, the medicine, and all of this, and inspired the men to keep going. So this is what I was thinking about, and just heard it. And, we've always taken our lead from women. And as a Cree man, even when we went to war, we asked the grandmothers, the women before, is this a good thing? And if they said no, then we didn't. We always took our lead from the women, and we always well. And so support in there, and it's just amazing to hear that these two strong women are doing this, and so many other. And that's incredible. So with that, I just want to say miigwech. I was raised by my mother, so and she's always take my lead from the women and my wife and everything. So with that, and I think that it's something to the dominant culture needs to recognize, right? And we're all in the circle together, but as equal. But we both have our places in that, and that's relearning that. And I just want to say miigwech to my sisters for all the hard work they do and everything. So with that, I just want to say miigwech. Take a moment or two and just, again, my prayers, my thoughts go to my sisters here who are mothers, and bless their children, bless them physically, mentally, spiritually, and all the hard work they do and the sacrifices they make to work in the community. So I say miigwech to all the sisters out there, and the grandmothers and everything, for doing all the hard work. And I say thank you to the Creator for bringing us together in these good words. So with that, I say miigwech to you, to the earth, the sun, the sky, and creation. All my relations. Miigwech.
All my relations. Thank you so much. And it's wonderful to see everyone here. And remember to do the feedback survey that's in the chat, and to share the archived presentation in your social networks so that as many people can see this message.